I've been dealing with families, particularly two families who had children whose friends were lost in the fire, were presumed lost in the fire because there's been no confirmation. So it's a little boy, one of the boys who plays football with his friends, and they've disappeared. And his parents really don't know what to say to him.
And we can't talk specifics about these families because of preserving their identity, or their privacy. But how do you go about dealing with such an horrific event affecting young children?
Well, I guess you have to take it at their pace. You can't have the kind of adult sensibilities about how to deal with, but you have to wait on what they ask or what they want from you and the support and comfort they want from you. Because it's horrific enough for us as adults to imagine how people perished in that fire. For a child's imagination, it would be unbearable. It would be unbearable.
And do you find that in dealing with something like this, that people feel compelled to ask those really hard questions about what may have happened to people they love, or are they skirting around it? Do you encourage them to try and confront those images that they might have in their mind? No,
I don't encourage them. I think there's plenty of time. And with children, time is really useful. In their own time, they will acknowledge what has happened and might want to ask a question about it. In many cases, children actually try to forget. What's technically called dissociation. They dissociate because they don't want the horror of the immediacy of knowing what's happened. So they try to forget, and then it'll gradually come back when it's manageable for them to think about it psychologically, or to actually accept that they probably have lost two friends in the fire.
In the days after the fire happened, I spoke to people down at Grenfell Tower who were clearly traumatised and upset by what they witnessed, or people who were missing, but they didn't necessarily realise that they needed to perhaps seek out some counselling or talk to someone about it. Is that quite common, and what would you say to those people?
It is quite common, and some people might want to talk about it then and there, you know, immediately. And for some people, it'll be something that they want to talk about maybe in a few weeks' time, a few months' time, because it really has an impact on them at then. You know, there's no saying when it is that it will really affect you. So I think that the important thing is for professionals and networks to expect that people want to talk about it. This idea that it'll be fine and we can forget about it, that really isn't the case. People will be affected. It's just that they will show it at different times and in different ways.
Lennox, many thanks indeed.
Okay, thank you.